Hello, Mr. Moss.
Hello.
My name is Steve Atkins. I'm going to be your nurse.
Mm-hmm.
I'm going to be performing a normal health assessment.
Okay.
First, we're going to start off with taking a set of vital signs. I'm going to take your blood pressure, pulse ox, temperature. Have you ever had a health exam before?
Yes.
Okay. Well, I'll explain everything before I do it. You're going to feel this tighten up. All right, up under your tongue, I'm going to check your temperature. Okay, good, good, good. All right, slip this on your finger. This is going to get your pulse and your blood pressure, or your pulse ox and your pulse. All right, while I'm here, I'm going to palpate your radial pulses and make sure that they're equal. All right, radial pulses are equal and present, +2 in both arms. Blood pressure is 129/79, heart rate of 56 and regular, and O2 sat of 99%. Okay. All right, turn this off. I'm going to have you stand up and step over there to the scale. All right. Thank you. Thank you very much. Move this out of the way. While I'm here, I'm just going to take a look at the patient's general appearance. Hair appears to be evenly distributed. Nails appear to be in good shape. Good size, trimmed. Patient is well groomed, speaks clearly and concisely. We're going to check your skin turgor. Skin turgor is good. The skin is warm and dry. Good general appearance. Now we're going to move over to the head. I'm going to palpate your scalp. I'm going to be feeling for any abnormalities, any lesions, any knots. The hair is evenly distributed. Face is symmetrical. That's cranial nerve number 7. We're going to check your temporomandibular joint. I'm going to put my hands back here. If you would stick your jaw out, move it to the left and to the right. Okay. All right. Now I'm going to feel of your temporal artery. I feel a good pulse on either side, both left and right. Now we're going to check your sinuses. Tell me if you feel any pain.
Okay.
Right there.
No pain.
All right, up under here.
No pain.
No pain. Excellent. All right, now we're going to move to the eyes. If I can get you to remove your glasses. All right. I have this otoscope ready to go. First thing I'm going to do is I'm going to shine a light in your eyes. Just look at my nose. We're going to check your pupils. Equal and reactive. Now, both pupils are equal, round, and reactive to light. Now I'm going to come over here and I'm going to take a look inside your eyes. We're going to be checking for the red reflex, and the reflex is present. The discs are a creamy yellow and they round in the left eye. Red reflex is present. Discs are creamy yellow in the left eye as well. And the vessels both appear to be normal in number and the color. Now we are going to come over and I'm going to check your cardinal gazes. If you would look up at my nose, what I'm going to have you do is follow my finger. And I'm going to move it from one point back to your nose. Just don't move your head, just follow it with your eyes. Starting here. Checking for accommodation, just follow my finger in, back out. Accommodation is present and normal. Now we're going to check the ears. Swap my scope over. All right, I'm going to look at your ears. They're symmetrical. Do you feel any pain?
No.
Okay. All right, no pain, symmetrical. We're going to have a look in your ears. All right, left ear. There's no pus, no redness noted. The tympanic membrane is a pearl gray color. We're going to assess the same thing on the left side. Tympanic membrane is pearl gray. Everything is clear. No pus, no redness, no swelling. All right, now we're going to do the whisper test. I'm going to whisper in your ear. I would like for you to repeat it back for me. And then I'm going to do the same thing on the other side. Okay?
ABC. 1, 2, 3.
All right, excellent. He is able to correctly repeat back everything that I whispered to him. Now I'm going to conduct the Ryan and the Weber test. Fortunately, we do not have a pair of tongs, so I'm going to simulate it. And I would do so by striking the tuning fork and then placing it over his head for the Weber test. So I'd strike it over the head. Tell me when you...
No.
Now? All right. And for the Rennie test, I'm going to strike it, place it behind his ear.
No.
Tell me when you hear it. All right. Same thing on this side. Strike the fork, place it behind, and now he's able to hear. All right. Now we're going to move down to your nose. And I am going to take a look at the nose. The nose appears to be symmetrical. And we're going to check for the turbinates. Make sure that they're red, no swelling. Everything appears to be normal inside the nose. You feel any pain,
no pain.
Tenderness? The nares both appear to be patent. And now we're going to assess your sense of smell. So I'm going to have you close your eyes.
Mm-hmm.
I'm going to place an object up under your nose.
Mm-hmm.
You tell me what it is that you smell.
Alcohol. Lemon.
Excellent. Excellent. Good deal. He correctly identified the alcohol swab and the slice of lemon. Now we're going to move down to the mouth and throat. Take a look at the lips. They appear to be pink and moist. Now I'm going to have you stick out your tongue for me. Say ah.
Ah.
All right. See the uvula moving. That is cranial nerve number 12. Now I'm going to take a look inside the mouth. Teeth appear to be straight. Oral mucosa is pink and moist. I see no abnormalities, no swelling. Are you having any pain in your mouth?
No.
Excellent. Excellent, excellent. Now we're going to check your gag reflex. I need to grab a tongue depressor. So we checked cranial nerve number 9. When you stuck out your tongue and said, ah, now we're checking cranial nerve number 10, gag reflex. Got it. You're able to stick your tongue out. Cranial nerve number 12 is intact. All right. I'm going to check your temporal muscles. Can you clench your jaw for me? Cranial nerve number 5 is intact. All right. Now we're going to move down to the neck. All right. The neck is symmetrical. Is there any pain upon palpation?
No.
Cervical column appears to be intact. Trachea is midline. Now I'm going to assess the lymph nodes. All right, and the thyroid is palpable. There are no nodules present. Now I'm going to check your range of motion. I'm going to have you move your head from your left to your right, front to back. Now place your head towards your left shoulder. Now push against my hand. Same thing here. Excellent. All right, now we're going to take a look at the chest. Just breathe normally for me. The chest appears to be symmetrical. Breathing is effortless. Normal rate, about 14 times a minute. We are going to come over here and assess lung sounds at this time. I'm going to start in the back. Take a deep breath and release. Take a deep breath and release. Take a deep breath, release. Deep breath, release. Deep breath and release. We've listened all the way from the top lung field, mid-clavicular, all the way down to the mid-axillary on the right side, and we will do the same on the left. Take a deep breath and release. Deep breath, 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 and release. Excellent. Back here, I'm going to check your spine. Tell me if there's any tenderness. Any tenderness?
No tenderness.
All right, the spine appears to be midline. No deformities noted. Coming over here, I'm going to assess breath sounds. Front. Take a deep breath, relax. Deep breath, relax. Deep breath, relax. Deep breath, relax. I'm going to have you raise your arm if you can. I'm going to check. There we go. That's perfect. Deep breath. Excellent. Coming over on this side. Deep breath, relax. Deep breath, relax. Deep breath, relax. Deep breath, relax. One more. Breath, relax. Excellent. All right. Now I'm going to have you lay back. Before you do, I forgot one thing. We're going to assess for tactile fremitus. I'm going to place my hands on your back, and I want you to say 99.
99. 99. 99. 99.
Tactile fremitus is palpated. All right, now I want you to lay down. All right, we have good lung fills. I didn't feel any lumps or tenderness. Respiratory excursion and expansion is normal. Now we're going to assess the heart. I'm going to assess the aortic valve, second intercostal space to the right of the sternum. Assessing for S1, S2. I don't hear any murmurs or gallop. I'm going to assess the pulmonic valve on the second intercostal space to the left of the sternum. Sounds normal. Now I'm going to assess for Erb's point, which is at the third intercostal space to the left of the sternal border. I'm going to check the tricuspid, which is the fifth intercostal space to the left of the sternal border. Sounds normal. And I'm going to assess the mitral valve, which is the fifth intercostal space, the midclavicular line. And again, that sounds normal. No murmurs, no gallops. Now we're going to move our way down to the abdomen. I'm going to inspect his abdomen. The umbilicus is in midline, appears to be normal. I'm going to inspect the abdomen for any masses or lesions. Everything appears to be in order. Now I'm going to assess bowel sounds. moving up to the right upper quadrant. Moving over to the left upper quadrant. And to the left lower quadrant. Vowel sounds are noted. Now I'm going to palpate. Starting here. Tell me if there's anything that hurts.
No. 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 No.
All right, no mass is noted. Now I'm going to palpate the liver. Should be able to partially feel it. I do. It's right where it should be. No abnormalities noted there. I'm going to assess for the spleen. You should not be able to palpate it. Unable to. Excellent. I'm going to come over the bladder. No mass is noted. All right, sir, if I can have you sit up. All right, I'm going to check your lower extremities. We're going to check a popliteal pulse. Both are present and equal. I'm going to come down and check the posterior tibial pulse. Both are present and equal. And with socks and shoes off, I'm going to assess for the dorsalis pedis pulse. Both are present and equal. I notice no swelling, no edema, no redness. The toenails appear to be trimmed. Everything appears to be normal. Now I'm going to check your reflexes. So with the Bellarmine stethoscope, I'm going to assess your right arm. There we go. There we go. All right, and the right. Excellent. Now moving over to the opposite side. Excellent. Excellent. Now I'm going to check reflexes in your knees. Reflexes in your Achilles heel. Excellent. Excellent. All right. Temperature of the lower extremities is as it should be. Now I'm going to have you push up against my hands. I'm going to have you push down against my hands. With both legs, I'm going to have you push out against me. All right, and then pull back against me. Excellent. Now with your upper extremities, can you grip my fingers? All right, can you push against my hands? Can you pull against my hands? Excellent. Now if you would, I'm going to have you stand up and bend over and touch your toes and stay there. Normal curvature of the back. Again, I'm going to palpate the spinal column. Does any of this hurt?
No.
No tenderness?
No.
And the cervical spine appears to be intact, and the spine all the way down appears to be midline and intact. You can stand up. I'm going to have you do the Romberg's test. This is going to assess your balance. I want you to close your eyes and put your arms straight out in front of you. All right, you can drop your arms and open your eyes. Now I'm going to have you slightly bend your knees and come back up to a standing position. Excellent. All right, so now we're going to walk over here and we are going to do a visual test. We have a Snellen chart up against the door. We're going to stand 20 feet away. And I'm going to have you do this with your glasses on and glasses off. So with your glasses on, can you read the lowest line that you can see?
FELOVZD.
You have 20/25 in your right eye with your glasses. And close your left eye and do the same.
FELOPZD.
All right, line 7, that's 20/25 vision. Now take your glasses off. And can you attempt with one eye?
A white chart.
Okay, all right. So you're unable to see any of the letters without visual aids.
The left eye.
Okay, excellent. All right, thank you very much. And come back. I'm gonna have you stand right here and walk towards me. I'm gonna have you walk heel to toe until I ask you to stop. All right, now if you'll turn around, I'm gonna have you walk on your tiptoes. Okay, excellent. If you turn around towards me, if you'd walk towards me on your heels. Excellent, thank you very much. And if you would just turn around and walk normally. And the patient has a normal gait. All right, and you can walk back and have a seat. All right, and now just a few more things and then we'll be finished. All right, can you close your eyes, hold out your hands? Can you tell me what this object is?
My pen.
Excellent. Now hold out your hands again, tell me what this object is.
The stethoscope.
Excellent. All right. Now, are you able to feel this?
Yes.
Good sensation in your arms?
Yes.
How about here?
Yes.
How about here?
Yes.
Here
Yes.
and here.
Yes.
All right. Well, normal exam, normal findings. Thank you very much for your
All right.
time.
Thank you.